We're living in uncharted territory, with a pandemic bringing major cities, even countries, to a halt.
Working together, we must defeat COVID-19 with the only tool that we have available to us.
COVID-19 cases are rising throughout the country, and new measures have been imposed to stop the spread.
No dining in at bars and restaurants and gyms will be closed.
As you adjust to this new normal,
we even talk about discipline and structure because the kids are home all the time.
We're answering your questions about prevention, government response, and testing.
We will have the Roche kits that we have been trying to get so we can open up our 2 pod sites.
And if you think you're infected with COVID-19, we'll take you step by step on what to do. It's information coming straight from your local leaders and medical experts. Live from South Victory, this is Coronavirus in Texas, a town hall. And we know you have a lot of questions about coronavirus, and we will be getting answers over the next hour. Thanks for joining us for this special edition of WFAA News at 6. I'm Chris Lawrence.
Good evening. I'm Sonia Azad. You know, every day we are getting new information about coronavirus and how it's affecting really all of our lives. And I know that for a lot of you, it is incredibly overwhelming. Tonight, our goal is to take the time to answer your questions calmly and clearly.
Yes, several local leaders are joining us tonight.
Joining us from Fort Worth, Mayor Betsy Price, also Dr. Veer Vittalani, and also with us live from Fort Worth. Oh, they're from Fort Worth City Hall. There they are. Also, Arlington Mayor Jeff Williams and Dr. John Carlo, who led Dallas's medical effort during the 2014 Ebola crisis. They are here to provide additional perspective.
You know, we're also expecting Dallas County Judge Clay Jenkins and Dr. Philip Wong to join us, but they got called into a special commissioner's court meeting. So, you know, these things happen when you're dealing with a public health emergency. We do hope to have them when it's over.
All right, here's what you can expect over the next hour. We're going to take your questions on a variety of topics.
Yeah, we'll talk about those new restrictions that Governor Abbott announced today, testing, supplies, how the virus spreads. Now, our goal tonight is to empower you with the information you need to protect yourself and your family. And to do so, we're going to connect you directly with the leaders who are guiding North Texas through this pandemic. There are 3 things you need to know about asking your coronavirus questions tonight. You can text your question to 214-977-6028. You can ask it on our WFAA Facebook page, or if you're watching on YouTube, just leave a question in the comments. Our David Schechter is monitoring all of these platforms, and he's going to be taking your questions throughout the hour. While you get those first questions in, we want to check in with Chief Meteorologist Pete Delkus. Some storms on the radar, Pete.
Yeah, and I tell you what, Chris, right now we have a tornado watch that's in effect. It does not include Dallas County, Tarrant County, or Denton County, but Grayson County, Collin County, Rockwall, and Kaufman County, and everywhere to the east is under that tornado watch until 10 tonight. Please don't take this too lightly. We now have 2 confirmed tornadoes from last night. One was in Young County, not far away from Graham. The other one was in just outside of Bridgeport, just on the north end of Lake Bridgeport. Both EF1 tornadoes. Right now we have nothing severe, but we have a big cluster of storms that have moved through. Right now, winds are gusting to 30 at DFW. The rain is really coming down. You can see the thunderstorm is approaching downtown Dallas, and here it is. Here's our cluster of storms. It's not severe right now, but it extends anywhere from Collin County, outside between Blue Ridge and Anna, off to the south from McKinney, down to Richardson, Plano, into Irving and Grand Prairie, minutes away from downtown Dallas, and then southwest from there. Here's the track. It'll arrive in Arlington any moment now. Dallas about 6:37, Greenville 7:17. If it holds together, Lancaster at 7:51, and then in East Texas after that, Corsicana a bit later on tonight. So there's the planner. Showers and storms for the next several hours. We'll be here not only throughout this hour during this special report, but we'll be here, our weather team will, throughout the evening, keeping an eye on the severe weather threat. I'll be back in a few minutes with another update.
All right, Pete, thank you. So before we dive into your questions, we want to update you with the latest on the coronavirus numbers here in Texas.
Yeah, here's a snapshot of today's big developments. Governor Greg Abbott has issued a statewide emergency, an executive order that limits social gatherings to 10 people, prohibits dining in at restaurants and bars, and closes schools across the state. But the governor is encouraging every district to expand remote and virtual learning. Dallas County reported 20 new cases today and its first death. A man tested positive for COVID-19 after being found dead in his home in Richardson. Right now, Texas has 140 cases of COVID-19. And the State Department is telling everyone, do not leave the country. This afternoon, officials raised the travel advisory to its highest level, 4, and warn U.S. citizens to avoid all international travel. And at the White House today, President Trump announced the FDA will fast-track treatments for this novel coronavirus. That includes testing an anti-malaria drug as a possible treatment for COVID-19. But just be aware, there's still months of testing and research ahead.
All right, let's get right into the questions. First, I want to get your reaction to today's announcement by Governor Abbott. Let's start with Mayor Betsy Price, and then we'll go on to Mayor Williams.
Certainly. Thank you for having us. I think this is a great way to communicate with our residents and try to help alleviate a little bit of the fear. We were not particularly surprised at the governor's order to move this to 10. It fits perfectly in with what the president was saying. In Fort Worth, we already had in place a limit of 50, so today my council met and lowered it to 10 and left in place the closure of restaurants and bars and gyms and other things. I think several of us in the Metroplex are very similar now, but we're pleased as cases have begun to escalate with additional testing. We're pleased to see that gathering lowered.
And Mayor Williams?
Well, we actually had Governor Abbott in Arlington yesterday, and he spent quite a bit of time asking for input and sharing with us what he was going to do. And frankly, I think it's the right thing to have uniform regulations across our state. This is such a fluid virus, and the opportunity for all of us to be working together in unity and following the same restrictions, I think, is very important.
And just to follow up about that, Russ C. from Plano says, folks who work in barbershops, nail salons, hair salons, they're coming in close contact with people. Are they going to be shut down too? Mayor?
Which mayor do you want, Chris?
Oh, sorry, Mayor Williams, I'm sorry.
Yes, well, they are not. This did exclude the businesses. However, social distancing and following the regulations and restrictions that we have are so critical here to all of our businesses. In fact, I would encourage, there's lots of other businesses that they can work from home. They can use telephone conferencing, teleconferencing, and so forth, because we do need to limit as much as we can that contact.
Well, and I'll just say, as a woman, it's pretty hard to social distance getting your hair or nails done. So maybe that's an indication that if you don't need to go, really need to go, then probably not a good idea to go right now. Is that fair to say, Mayor Price?
I'll agree with that. If you can at all stay home, don't go out. Don't go get your nails done or your hair or your pedicure. And men, don't go get a shave and a haircut, as they used to say. But really the reason that salons and things weren't closed and the bars and restaurants were has to do with the density. The bars, restaurants have so much more density and very little space between people. If you are getting your hair cut, you probably know that person, and there won't be other people that you don't know besides you. They can social distance in the salons and barbershops.
All right, thank you, Mayor. The other big topic, obviously, a lot of folks have wondered about testing. PH from Dallas wants to know, where do people go for testing? Doctor, can you take that one?
Well, I'll try. I will say that is definitely a tough question right now. There is a strong need for testing, and it's certainly not up to the demand that we're seeing right now. The good news, though, is hospitals do have the testing capability, so for patients that are coming in with severe symptoms, they are able to run a coronavirus test in order to make the diagnosis. Doctors' offices are coming online, so many physicians are getting the tests from commercial laboratories and are able to run that for their patients. But we're still hearing much, much greater demand than that. And, if you can't get into a physician's office or a doctor's office or don't have a primary care doctor that's running that test, that's certainly a gap right now in the community.
All right, Dr. Giancarlo, thank you for that. We have to take a short break. You can go ahead and send in your questions, and we'll be right back to answer more of them after this.
We told you that we were going to be taking your questions online. Let's get to David Schechter for a few of those. David?
Chris, we have a question for Mayor Price here. Officials in Sacramento, California had announced a shelter in place just earlier today. And we have a question from Maria Jimenez who says, are we going to lock down next like California? Mayor Price, is a shelter in place order something that is possible in Fort Worth?
Well, Maria, I don't see that coming immediately, but certainly it's on our criteria to be evaluated we're listening to our medical professionals and community health people, and we're taking everything into account. But right now, I don't see that happening. It's certainly not anytime immediate, but a week ago I wouldn't have said we'd have every bar and every restaurant closed, because this is an incredibly fluid process.
Indeed, everything is moving super fast, obviously, so the same question to you.
Absolutely.
Mayor Williams, what would it take, what would the criteria be in order to do a shelter in place in Arlington? Because things are happening so quickly.
Well, they are, and of course we've had 3 council meetings this week to respond to the fluid nature of the virus. I loved what Mayor Price said about the fact that we never say never, but however, I am very encouraged because our people are obeying the restrictions. They're cooperating, and our businesses are cooperating, and I'm very hopeful that with this cooperation of social distancing, cutting out the meetings, not going to social gatherings, and in fact in not having that opportunity in the restaurants and bars, that we can help really cut down on the exposure of this virus so we don't get to that point.
Thank you. So let's go to Dr. V, also in Fort Worth. We've seen a lot of people exercising outside. That's pretty much the last thing that people can do for a little recreation. Dr. V, what are the concerns? What should we be thinking about when we're exercising outside? Is that okay?
Sure. So with most of our social distancing processes, the most important thing is that you're staying a decent distance away from people. So you want to stay at least 6 feet away from each other. If you're outside and you're exercising, it's great. It's a great time to get some fresh air. Unfortunately, it was raining pretty badly just earlier, but when the sun is out and it's time to go enjoy nature, go enjoy your neighborhood. It's okay to wave at each other from across the street, but you don't want to be running in pairs if you're not living together. But it's a great time to exercise outside and get back in touch with nature at this time.
Okay, thanks for answering our questions there from our viewers out there on social media, watching us on television. We'll be right back. Keep sending those questions in. More questions on the way.
Your hair looks great. Welcome back. Judge Clay Jenkins and Dr. Philip Wong from Dallas County have joined us. Obviously, they were called into a special meeting, and we want to remind you we will be answering your questions until 7 o'clock. You can text those questions to 214-977-6028. Of course, you can always leave questions in the comments on our Facebook and YouTube live streams.
Okay, so gentlemen, I've spoken with both of you a lot in the last few weeks. We are getting a tremendous number of questions about testing. Specific areas, meaning, one woman wrote in via Instagram and said, I need testing in Richardson Garland. How do I get that? And then I've also had questions about at-home testing. And Dr. Wong, maybe you can address whether that's a viable option. We can start there.
Sure. It's not out there. I've seen some information about something that might become available, but to my knowledge, it's not available at this point. But certainly testing is something that we've been just talking about and working on every single day here.
Is it all streamlined? It's the same test, the same swab? It's not.
Same swab. So there was actually a change earlier this week. Previously, we had to use 2 swabs, so a nasopharyngeal and then an oropharyngeal. And so that actually, when we were doing our testing in our lab, it took 2 test slots for every person. Mm-hmm. Now this week they said you could just use the nasopharyngeal in 1 test, so that actually sort of doubled our capacity for testing at our lab.
And just speaking to its capacity, I know when Colorado rolled out its drive-through sites, they were overwhelmed pretty quickly. Wait times of 3 hours. They had to cut it off after 100 or first 200 people. What will you be doing to make sure you don't encounter that problem here?
So you'll still need to fit that CDC guideline to go through the testing. We have federal inspectors coming down, hopefully, in first thing in the morning, if they're not there today, to look at our plans and make sure that they comport with that. And everybody's getting to learn from the ones that have gone before us. So we expect it'll be quite successful.
And I know Parkland stood up theirs this Monday, and it wasn't just for people to drive up and say, hey, I want to be tested, but they had to have been sort of pre-screened and been given a slot to say, hey, to show that you're approved for that, getting the testing.
We want to get to Dr. V and also Dr. Carlo, because there are a lot of questions coming in about who's high risk. Okay, I did a little segment about underlying health conditions, what exactly that means. Mary A. from Ellis County says she is 62 years old. She has had cancer twice, so she wants to know, is she considered high risk? And Dr. V, we'll start with you.
Yeah, so there's a definite group of individuals who are considered high risk. So we talk about those over 65, those who are currently undergoing treatments that would make their immune system compromised, those with heart and lung disease in pre-existing fashions. I think the important thing is when you're concerned that you need to get tested, if you're having fever, shortness of breath, cough, the most important thing is to reach out to your physician so that you can go through the screening process. And the reality is testing is important. But we have to make sure that the right people are tested. And so if you reach out to your physician, they will route you to a screening process. A number of the local health systems have stood up either online or phone screening processes, and that is your first inlet into testing. So it'll ask you about your high-risk features and whether you categorize as that or not. It'll ask you about your symptoms, and then through either an in-person or a video interview with a physician, the determination as to your testing and your high-risk status would be made.
And Dr. Carlo, I want to ask you, you had a lot of experience in terms of managing the response to the Ebola crisis. Justin wants to know specifically how the virus spreads on surfaces and person to person.
Well, coronavirus is a respiratory virus. We know this because we have normal human common cold respiratory viruses that are also coronaviruses. So we know it's those respiratory droplets. And, to be real clear, that's that wet stuff that comes out of coughs and sneezes. And we know that's the biggest risk. So, that's why the guidance is really important. You've got to cover your mouth and nose when you cough and sneeze. Now, those things do fall onto surfaces, and that's the other risk is, you come into contact with the surfaces either on a tabletop or a doorknob or other surfaces. And absolutely right, if those are on your hands and then you touch your mouth or your face, that's how you can become sick with coronavirus. So again, that's another place where you break that chain and you have good, solid hand washing. And I'll tell you, that's probably the most effective thing you can do to prevent getting coronavirus is really washing your hands every time you're in and around the situation where you're touching common things. And then finally keeping your surroundings safe and clean. There are great things that we can do in order to make sure our surfaces are wiped clean, and really the coronavirus can be removed off of those surfaces very easily. So just some practical things that we already know. The good news is, in many ways, while this is a new virus, we've seen coronaviruses for many, many years, and so we know how to protect ourselves.
Well, and Dr. Carlo, this week, the New England Journal of Medicine came out and got more specific about how long the virus can live on surfaces, certain types of surfaces. Can you address that?
Well, I think there's the theoretical of how long something can survive, and I think certain surfaces certainly have higher risk, or the respiratory droplets can stay wet, or the virus can stay viable for longer periods of time. I think for all of us at home, and really what we need to be thinking about, rather than looking at the specific surfaces, is just really being watchful of the surroundings themselves. There's definitely some places like the doorknobs, elevator buttons, places where you have high touch, high contact. I think we need to worry about those first, and do the best we can with all of the other surfaces and the risks there. But again, at the end of the day, we can't clean everything, and so that's another reason why we have to go back to our hand washing.
All right, Dr. Carlo, thank you very much. Again, you can text your questions to 214-977-6028, as well as leaving comments on our Facebook and YouTube pages. We'll be right back. All right, let's get back to David Schechter with some of your questions online.
Thanks, Chris. We have a question for Mayor Price in Fort Worth. This comes from Terry Sparkman Johnson on Facebook. Are the Parks and Recs departments from each city sanitizing restrooms, water fountains, bicycle stations, playground equipment, that kind of thing? If they are, how thoroughly, how frequently?
Yes, in Fort Worth, they're doing their best to sanitize as much of it as humanly possible. And after rains like this, they're in better shape, so they'll go back again. There's not a real set schedule at this point that I'm aware of. There may be. The bicycle stations, our friends at B-Cycle are sanitizing the bikes and the bike stations on a daily basis. We're doing, folks, all we can. But remember, the most important thing you can do is wash your hands.
Sure.
And that will help with all of this.
Absolutely. And Mayor Williams, in Dallas, I've seen some playgrounds that say playground closed. What's the condition, accessibility of parks, and how are you handling those?
Well, we have closed our recreation centers. In that, we were just too worried about the spread of the virus. But however, our parks are open, and again, we're practicing social distancing. And as Mayor Price said, our crews are going out every day to take care of that.
Thank you very much. And let's go to Dr. Wong in Dallas. We have a question from Jules Elizabeth. She says, what about people who enter your house to fix your AC or plumbing, and perhaps you saw they didn't wash their hands or they seem sick? I know a lot of people are bringing people in to work on their homes now because they're home. What should we be thinking about there?
Well, we're telling everyone if you're sick or have symptoms, stay home. So, certainly make sure that the worker coming into your house is not sick, is not coughing, have any symptoms like that. And then it's the same thing, in terms of cleaning your surfaces that are frequently touched or the surfaces that may be touched, and practicing your own personal hygiene, washing the hands, don't rub your eyes, nose, and mouth, and those same practices.
Dr. Wong, thank you very much. We'll be right back with more of your questions.
Live from South Victory, this is WFAA News.
Thank you for staying with us. I'm Sonia Azad. You are watching a special edition of WFAA, our Coronavirus Texas Town Hall. For the last half hour, we've been answering your questions about the response to coronavirus here in North Texas, and we're continuing to do that now.
Yeah, over the last couple of weeks, your world has drastically changed, and every day may feel like you're getting information overload, but the purpose of this town hall is to answer your questions, and we're going to walk you through this clearly and calmly.
That's right. We've got several local leaders joining us tonight, some of them here in our South Victory studio. We've got Dallas County Judge Clay Jenkins, also Dr. Philip Wong, Director of Dallas County Health and Human Services. Both have been at the forefront of the county's response to this pandemic.
Several leaders across North Texas are joining us remotely. Fort Worth Mayor Betsy Price and Dr. Veer Vithalani have been answering your questions from City Hall. And Arlington Mayor Jeff Williams is joining us as well. As well as Dr. John Carlo. Dr. Carlo led Dallas's medical effort during the Ebola crisis 6 years ago. Okay,
so there are 3 things you need to know about asking your coronavirus questions tonight. You can text your question to 214-977-6028. You can ask it on our WFAA Facebook page. I see a lot of great questions there tonight. Or if you're watching on YouTube, just leave a question in the comments and our David Schechter will be monitoring your questions. Before we get to some of those questions, we want to take a look at the weather because, Pete, we might have some rumblings out there soon.
We did have 2 tornadoes confirmed last night. One was in Young County, one was also in Wise County. We have another tornado watch up tonight. It does not include Dallas, Tarrant, or Denton County, but it does include Grayson County and Collin County. Now, you may be dropped from this watch here momentarily, but everywhere east of Dallas is under a tornado watch until 10. Remember, a watch means conditions are favorable. And as we look outside right now, thunderstorms are to the west. They're moving through the Dallas-Fort Worth area at this point. And we're looking at mainly some peat and nickel size hail. We have no severe thunderstorms right now, but peat and nickel size hail, 50-mile-an-hour wind gusts are taking place. This complex is moving through Dallas County. It's not severe. It's off to the northeast and even down to the southwest. That's where the thunderstorms are. They're intense between Bonham and Ladonia, but they're not severe. Over toward Leonard, you're getting dumped on pretty nicely. And then from Burleson, Cleburne, a little bit of light rain. Glen Rose, just south of you down toward Hyco, we have some thunderstorms. But once again, these are not severe, but they're now moving into an atmosphere that's more favorable for severe thunderstorms. So we will watch that as we head through tonight. They're moving off to the east at about 35 miles an hour. They'll be in Dallas momentarily. Light rain falling right now. Paris at 7:21, Lancaster at 7:43, Terrell 8:20. Those are the times, those are the locations. We'll be here throughout the night, as we always are. We'll keep an eye on these thunderstorms, but remember, a tornado watch in effect right now for all locations east of Dallas. We'll keep you updated.
Thank you, Pete. Hopefully we come through this with minimal damage. Let's get back to your questions. Ventilators range in price from $25,000 to $50,000. Plus, you got to add in the cost of training people and staffing them. You know, most hospitals can't afford to, drastically increase their inventory. So is that something local government will have to do, or are you counting on the governor to sort of procure these ventilators for the state?
Well, I've asked the president, and I believe it's time for us to follow the lead of Great Britain, where they've asked other manufacturers to start manufacturing these ventilators. Britain's done that with Jaguar. We should do that here. We can put up star requests, which is the way we get money together for ventilators. But the challenge is that local governments, cities and counties, have balanced budgets. So we're not able to print money like the federal government. We're not able to go out and do that. So that'll make it a challenge. This is an unprecedented time. We're going to look at everything we can possibly do to help our medical community have the resources that they need, and have had 2 calls just today with the team of local doctors that are overseeing the ventilators.
I have a follow-up question.
And I think Mayor Betsy Price wanted to weigh in on this as well. Mayor Price?
Yeah, I was going to agree with Judge Jenkins. We've been in close contact with the White House and staff and our partners in Congress and in the Senate too, and at the state with Governor Abbott's office and his team. There will be reimbursements for expenses such as ventilators and others coming. And much of our medical community is aware of that, and they've been working on it too. And I think the whole idea on the ventilators, the whole idea of the closing places and social distancing is so we don't get in a critical crisis where ventilators can't be had.
I don't know who wants to answer this, maybe one of the doctors, but I'm getting text messages as of this week from personal friends of mine who are physicians, some emergency room physicians locally in Dallas, who say we are short on N95 masks. Right now we are being told to reuse old masks. We have a lot of terrified doctors. Dr. V, do you want to take that question first?
Yeah, so the specific type of respirator that's out there that's most commonly used is that N95 mask, and unfortunately there is a shortage out there. We've been working both locally and regionally to identify alternative means of respiratory prevention and protection for not only our hospital partners but our pre-hospital workers as well. The production of this is part of what I anticipate will be ramped up, and we've received word recently that the Strategic National Stockpile, which is what the federal government uses to resupply health workers, is actually distributing N95 and other types of respirators.
And Dr. Carlo, while I appreciate that and I understand that there's a process and we have to be patient, how long can we really wait for something like this?
Well, there are some things we can do now. First of all, the N95 respirators do not need to be used in every single patient contact experience. And really, there are some things we can do in order to make sure that we keep those precious masks for when they're needed the most. And you are able to reuse the masks in certain situations. And so the CDC has put out guidance for healthcare workers in order to how to best use those respirators at the right time and also be efficient with the precious resources. As said, there are requests now out through the federal government with the Strategic National Stockpile that's going through the state of Texas. We certainly hope to get more, but I will say that, as healthcare workers, we're used to dealing with shortages quite frequently, honestly, and we're going to do the best we can. And thankfully, there are some things we can do in addition to having the N95 respirator in order to make sure we're staying safe.
All right, Dr. Carlo, thank you very much. We're going to take a quick break. We'll be back with more right after this. We really appreciate you continuing to send in your questions. Let's get back to David to hear more.
Thank you so much. This is a question for Dr. Wong. This is a question that I think a lot of people have been asking themselves. It's from Sonia Ranson, and she sent this in via email. She wants to know, can you get this virus again multiple times? And if not, how can you be sure?
We're continuing to learn more and more about this virus, but at this time, we do not think that you can get it again, that you will get immunity after having the infection. There's a couple cases that have been cited, but then it's thought that perhaps it was just a sort of a relapse of some of that initial infection. So bottom line, again, we continue to learn more, but we think that you will get immunity after the infection.
Thank you, doctor. And this is for Dr. Carlo. This came in via Twitter from Allison Wilson. She says, is it true that the warmer weather will possibly kill this virus? I know that's on a lot of people's mind. We've heard the president actually say that earlier on.
Well, I think the answer is we don't know. The seasonal pattern for, flu is really the influenza virus. It's not the coronavirus. So while warmer weather may do some things in terms of, the schools being out more frequently and how we change kind of our social atmosphere, that may be a factor. But I don't think we can say with certainty that the coronavirus would go away just because of the warmer weather or the more humid conditions.
Okay, thank you. Do we have time for one more question here? Okay, this is from Misty White. Let's go to Dr. V in Fort Worth. Misty says, are certain blood types more resistant to this virus than other types?
Yeah, so there's been some interesting literature coming out from the Chinese that are looking at specific blood types. As Dr. Carlo mentioned, this is a novel virus, and we are learning more about it every hour of every day. And so right now, I don't think there's anything definitive to say that one group is more or less susceptible, but there's the beginnings of some research pointing in that direction, and time and more information as it comes to light, we'll be able to have a better answer to that.
Okay, thank you. Great questions, North Texas. Please keep them coming. We'll be right back.
Okay, welcome back. We're going to dive right back into some of the questions. You know, I have to say, you know, both of us have been hearing from small business owners out there who are worried that once they close down, they are desperate. They're worried that they may never be able to reopen again. Mayor Williams, I want to ask you, is there anything being done at the local level to provide some sort of financial support for these businesses that simply can't open right now?
Well, needless to say, we have had an outpouring from both the private sector and the public sector, and the Small Business Administration has already sprung into action. But one of the things that is happening there in our community is that our citizens are rising up and saying, I am going to go to our restaurants to get takeout. We are going to support them, and we also have seen some real entrepreneurship, and especially in our small restaurants that have never done takeout or drive-through. They've created that now, and we've seen that in several of our restaurants. But it's a huge concern, but our people are responding. And then for us locally, we are pushing what restaurants that are open, and we're also pushing that through all of our means of social media. That includes our downtown Arlington, it includes our Convention and Visitors Bureau website, and also our city website. The other thing I would say that is happening too is that we have our churches that are coming together, and in addition to that, we also have a lot of our nonprofits who are actually going and picking up food, going to grocery stores to help many of our at-risk senior adults, to help them so they can stay in and be isolated. And it's been very uplifting.
Okay, and I just want to get some clarification, Judge Jenkins. So the relief for the small business owners would come from a federal level, right, not from the state or local governments?
Yeah, it's a federal level because they print money. And I hope that in this next stimulus package, they'll look at that. It needs to be a lot more generous than it has been so far. They're doing a good job so far, but we really need to focus, first and foremost on the workers, but secondarily on the small business people, because that's how the jobs are created, so that the workers will have a job 3 months from now, 4 months from now when this is open. For the restaurants, I want to say this. Chris Miller with Uber is working with me. The C-suite at Uber are friends of mine, and they will hook up the small restaurants as an accelerated Uber Eats. So if you contact my email, clay.jenkins@dallascounty.org, we'll forward that right over to Chris, and we'll get you hooked up with Uber Eats for delivery.
And I know that, with respect to all the restaurateurs out there, there are also a lot of fitness studio owners, gym owners who are small business owners who are feeling this just as much. And I don't know if there's anything that they can do in the meantime.
There's just no easy decisions left, and it's tough. I tell you, it's heartbreaking when you look at these entrepreneurs that have risked so much to build these businesses and what is happening to them right now. We have to err, though, on the side of following those CDC guidelines. We have to have faith in the science, and that's our guideline. And when the guideline is clear, when the president says Monday at 2 o'clock, close all gyms in states of community spread, we have to lead. It's up to county judges in these surrounding counties and myself to immediately enact those things. We cannot wait if the governor takes days next time. Okay. And I'm hopeful that he won't take that long anymore.
And I think Mayor Price, you also wanted to address this because obviously a lot of struggling businesses there right now in Fort Worth.
Yeah, and it's a terrible decision to have to make as an elected official to shut down businesses. It's really hard. I'm a former small business owner, and I can only imagine. But they need to remember, too, we've got some really creative things going on. Some of the gyms have gone to online classes only. They're teaching them online, and they're charging people a small fee, which helps them. But also, one thing they need to remember, if utilities, if their water bill, the electric, their gas bill, go delinquent, they won't be disconnected, and they'll be able to work with us at the city and with our friends at the other power providers to help give them some relief, at least relief on any penalties for being delinquent that might accrue.
All right, Mayor Price, thank you very much.
All right, we're going to take a quick break, and we'll be back with more of your questions.
We continue to answer your questions directly. David?
Yep, here's a question for Dr. Wong. This comes from Sherry Ackrey on Facebook. Why are we not testing people who have traveled, even though we know it's being transmitted inside the community, beyond travelers?
Well, the availability of testing is increasing greatly, and so we are now able to do, we're prioritizing hospital workers, first responders, as well as those that are at high risk for severe illness, those over 60 and chronic conditions. So the testing availability is increasing every day.
Okay, thank you for that. And this is a question for Dr. Carlo. This comes from Mark C., who says, I want to support takeout and delivery dining options, but I'm concerned if someone preparing the food is sick, which we saw today, or is positive without symptoms, can the virus be spread in that food, in the food service area?
Well, we don't think of coronavirus as a foodborne agent. In other words, there are plenty of infectious diseases that can make you get sick when eating food, but this is not one of them. But it is a good point to know that food handling could put you at risk. But I know the restaurants are doing everything they can to make sure there's good hand washing and proper technique. And if the food is properly prepared and really according to the guidelines that is set up under our regulations, then the food should be safe. But again, it's a great question. But the good news is coronavirus is not a foodborne illness.
And Dr. V, I know that you wanted to answer something on that as well. It really sounds like it's the restaurant, the public communal space, and really it's not about the food so much. Is that accurate?
Yeah, so I think our restaurant services have been doing a really great job of implementing policies to make sure that those people who are symptomatic, who are sick, are staying home. I think now more than ever, restaurant hygiene is great, and I think that there are a number of plans put in place in terms of no contact drop-offs, secure packaging, double wraps, etc., and ways to actually mitigate that. And I wanted to echo what Dr. Carlos said. It's not really a foodborne illness.
Thank you very much for that. Lots of people out there supporting their local restaurants and picking up that food to go. We'll be right back with wrapping up this whole Q&A, this town hall. Thank you for joining us.
We want to give you guys a chance to give your final thought, and we ask you to keep it to about 30 seconds, starting with you. Mayor Price?
Absolutely. This is a time, technology provides us a great time to FaceTime with people, Facebook, stay home with your family and connect with those who live with you, get online with the others, practice social distancing, and support your local restaurants and bars who might need you to take out.
Mayor Williams, 30 seconds for your final thought.
Well, we are in a fight, and so many things you can't do in this fight, but there are many you can. And one is to take care of your own personal hygiene, resist the old habits of shaking hands, and make sure you practice social distancing. But also, we've got to extend that hand of kindness to help each other through this. And in the end, we are going to come out stronger than ever before.
And Judge Jenkins?
Look, North Texas, you can do this. We have stood up to challenges before, and we've always come out stronger on the other side. But it's going to take moving from selfishness to sacrifice. We don't need to go to the grocery store and take all the food off the shelf. Leave some for your neighbors. And everything that we do, when you're taking that risk for yourself, remember, be sacrificial for those who are most vulnerable in our community. We have to move from panic to prayer and personal responsibility. And finally, we have to move from fear to faith, and not just your own faith in a higher power, but faith in the science. Everyone should be going to cdc.gov every day, seeing what the recommendations and guidelines are as they change. And that has to be our guidepost, folks. You have to follow the science. We have to follow the CDC.
Dr. Carlo, aside from hand washing and social distancing, 30 seconds for your medical advice, sir, for folks right now.
Well, for North Texas, I would say we can definitely do this together. We've got great leadership here. You have an amazing medical community, amazing health profession, that are on the ground doing the work that's necessary. And, I would just say that infectious diseases have been with human beings since the beginning of our time, and we will continue to have them, but we win. We have ways to conquer this, and I believe we will do it, and we'll do it together thanks to the great people that are both here with us today as well as the folks in North Texas that continue to work hard to keep us safe.
Yeah, you have to think, if we're all acting for the collective good, history is going to remember us
Certainly.
in a fairly good light.
We want to thank all of our guests for joining us today. We know that you're all very busy. You've got a lot going on, but we certainly appreciate the time that you've taken to be here with us and to answer our viewer questions. So thank you so much.
And I would really encourage you. Obviously, an hour isn't even enough to get to all the questions. There were things we wanted to know about. I'm sure there are things you still want to know. Keep your questions coming, because we could still get these experts to get you the answers that you need. Thank you so much for watching. Good night.